Do you snore? Does your child snore? Do you breathe heavily? Do you have noisy breathing? If you're in this category, don't ignore, this video is for you. I'm Dr. EC, an ENT doctor, and I also help mothers to heal and recover after delivery, especially after cesarean section delivery. So today I want to help you understand why noisy breathing happens, why that your child is always snoring, why you are always having heavy breathing. Okay, and also what you can do about it. But before we continue, let us understand something. Noisy breathing happens because the airway is partially closed. That is it. And this closure can happen in the nose, at the back of your nose, in your throat, and even in your mouth. Now, in children, here are the common causes of noisy breathing. Number one is enlarged adenoid. Adenoid are tissue, body tissue, but they are located at the back of the nose. So this tissue can go to the point that it starts obstructing the airway. Same as the second, which is the tonsil. This is located just behind the tongue, down in your throat. So you may have seen some children, they open their mouth to breathe, and when you look at it, you see, wow, I'm seeing a growth there. There is something growing in there. That is likely the tonsil you are seeing. Number three, if something is happening in the nose that is causing obstruction to the airflow, this could be as a result of allergy, catarrh, or even a growth in the nose. It can also be due to narrowing of the nose. If the nose is not as wide as it's supposed to, it can cause obstruction in the airflow. Now, in addition to these three, noisy breathing can also happen in the presence of an infection in the throat or along the airway. So if your child is having noisy breathing, snoring, these things I have listed may be responsible for it. Now, in adults, snoring can happen if you are obese, if there is a growth in your throat, there's a growth at the back of your nose, there's a growth in your nose, a growth in your mouth. So growth in all these places can result to noisy breathing in adults. It can also be a problem in the nose aside growth, like allergy, chronic catarrh, chronic sinusitis. Now, this brings us to what we should do when this thing happens. So I'll be giving you safe and practical things you can do at home first when you are faced with this challenge of noisy breathing, snoring, or heavy breathing. The first thing you should do is steam inhalation. Even for children, yes, you can do steam inhalation for them. The simple way to do that is to boil your water, pour it in a bowl, in a bucket, and sit down with that water. You can cover with a thick cloth, a blanket, and inhale the steam. This can also be done for children. You can carry the child, but please do not burn that child. The next thing you can do is to get a saline nasal drop or a spray. Yes, it's labeled. It's something you can buy over the counter. So, and please avoid triggers of allergy, especially for those who have allergies. So if it is dust, clean your environment, make it dust free, reduce your exposure to smoke, anything that you know that irritates you, try to avoid them and reduce exposure to it. And then while sleeping, try to raise the head of the bed. You can add extra pillow so that it can elevate the head, and that will improve breathing. And if it is as a result of obesity, this is the time to lose weight. Try to lose weight. Yes, it is very, very important. Haven't done all these things at home and yet no improvement, please, it is a sign that you need to go and see your doctor. And then other signs that should tell you that it is time to see your doctor are: one, if you're having difficulties sleeping, in the middle of sleep you suddenly notice that you cannot breathe again, or the child cannot breathe again, please, you need to go and seek medical care. All right. Number two, if you're having problems swallowing or you're having shortness of breath, you need to go and seek medical care as soon as possible. If there is fever, there is weight loss, you are not having good appetite, you need to go and seek medical care. So I hope this video helps you. Please do it to share it with your friends, and also remember to like this video, subscribe if you are yet to, and I'll see you in the next one. Let's talk wellness.